that. But I think one of the risks in this situation is the worried well. So a lot of people worried out there and wanting to go and get swabs. And if they all come to our emergency department at the same time, we're not going to be able to look after the heart attacks, the strokes, all the things that an emergency department needs to look after. So what we want to identify is people who are contacts, and whether they're either close contacts or casual contacts. This is a big suburb, and yet we have a small number of cases in a very isolated area. So if you have sat with one of those cases and had 15 minutes of face-to-face discussion with somebody who goes on to be definitely COVID positive, then you are a close contact. And public health will be chasing those individuals, and they'll be on a list and they'll be followed up. Contacts outside of that get much more diffuse as you go out, and it's much less likely that there'll be a problem outside of that immediate close contact group. So what we tend to do is try and identify that close contact group and follow that group quite intensely. And if people are in that group, then yes, they will be followed and have that problem managed. If they're outside of that group, they probably won't, but they might think they should be in that group, and that's the issue you're discussing. And we want to try and avoid too many people trying to insert themselves into the close contact group when they're not part of that group. So the fact that you've worked on this site is not a risk factor. You need to actually have a specific risk factor. Does that answer the question?
Yes, thanks.
Yeah. Okay.